The coronavirus pandemic has caused a terrible battle between two things on the top of people's priority list: health and wealth. So how do we protect ourselves from the virus without crushing our economy? An important question to ask right now. And we have two great guests ready to have that discussion. New York financial analyst Chris Markowski and infectious disease specialist Dr. MARTA Feldmesser of Lenox Hill Hospital. Guys, welcome to Chasing News. Let's start first, Doctor, with help us understand how this disease spreads and what has been done so far in America done to push back on the pandemic.
So first, how does the virus spread? The main way that it spreads is through the air. So if somebody coughs, we call them droplets. They're particles that can extend out for about 6 feet. One person coughs, another person inhales. It's very clear that this virus is very easily transmitted between people that are within 6 feet of contact. We use a number of different numbers, but most commonly you'll hear 6 for 6 minutes, okay? If one person infects 2 people, infects 4 people, and everybody does not stay away from each other, we have a very serious problem because the infection will spread very rapidly to a large number of people.
And we've seen that happen in places like Italy, Iran, China. We had, kind of a different situation in South Korea, where they seem to have a really strong handle on it with isolating and quarantining people. And they really flattened that curve in about 3 weeks. So let me ask you, Chris, on a financial end, how do you keep the economy going and balance the quarantine and the isolation? Because what we have right now is a wrecking ball that's been taken to our economy.
We were told from the beginning that 80% of the country is going to get this. Now, we don't want to overwhelm our healthcare system. We don't want doctors overrun. We don't want to have hospitals overrun, because they're not people just getting coronavirus. There's people that still have heart attacks, that have cancer, that have all of these issues. And in fact, that's what they're doing at the Javits Center. It's not for coronavirus patients. They're moving patients out of hospitals that don't have coronavirus out there. We have to get on that footing, so we're going to be able to deal with the influx of people that are going to get it. But at the same time, we have to balance that other aspect of our economy in regards to people are going to go out of work. The mortality for a small business in this country, the average small business, now small business actually employs half the country's workforce, is 27 days. That's it. 27 days of cash to stay in business. It's even worse for retail companies. Retail, it's 19 days, and then restaurants, it's 16 days. So it's tough for them right now.
Are you unhappy, as many of us are, with the response in America in terms of not quarantining fast enough, not isolating the vulnerable, meaning quarantining the sick, not the healthy?
It's hard to just isolate the sick because many of those who are sick don't know it yet.
But Doc, how did South Korea do it? They flattened the curve in 3 weeks. I mean, how did they do it? And we've been unable to get a handle on this.
They tracked individuals using cell phones and credit cards. They did extensive contact tracing that we have not done. They also had testing a lot sooner than we did.
Should this economy be open soon? If so, how soon?
I think we have to start thinking about at least certain areas of the country that have it more under control than others. You can't shut down the entire place. No one wants to wake up and say, okay, the virus is done, and then we have tumbleweeds.
Doc, is that reasonable what Chris said? You isolate where you have the high pockets and you get the machine of the economy starting to move again so we don't do more damage?
I think we have to be very careful. I think we have to put the public health interests and the concern for the vulnerable in our population ahead of the economy.
All right. Thank you, guys. Appreciate the time, Doc. Appreciate the time, Chris.